An update now on a Princeton woman who took herself off the organ transplant list because she couldn't afford the post-surgery related costs. Tonight, the Premier says his government is looking for ways to make things better for rural patients. CTV's Michelle Bernaro has more.
Christina Dirksen-Unruh was in Victoria this week on a mission to bring change.
We raised the issue of the inequities in rural health care for people like myself that have to travel to Vancouver.
Dirksen-Unruh needs a double lung transplant, but discovered she'd first have to save tens of thousands of dollars to live in Vancouver for 3 to 6 months after surgery at VGH. Lacking the required savings, she took herself temporarily off the transplant list. She told her story to the Premier.
Obviously a very moving story and a very troubling story.
The Premier says his government will look for solutions to help rural patients.
I've gone back and asked the Ministry of Health to work on this. It's a housing issue, like so many issues that we face.
It's a mental health thing enough to deal with just the transplant, let alone to deal with the financial burden.
Last month, William Hastings was in hospital dying until he says a double lung transplant March 27th gave him a second chance at life.
I'm so blessed to have been chosen to have a new set of lungs.
The Courtney man is required to remain in Vancouver for months for ongoing medical appointments. Family is helping with accommodation, but the expenses still add up.
For anybody coming from out of town, where they have to cover 2 households, one in Vancouver and their own household, it's very, very daunting.
BC Rural Health Network says there are about 150 transplant patients each year from outside the Lower Mainland.
It's often years and years of follow-up care that are required, and you have to be able to afford to reach that care, and many cannot.
He says in March, a rural BC woman who couldn't afford the expenses linked to out-of-town care died.
She had to have a second single lung transplant, and then she just didn't have the resources to do the follow-up care in Vancouver, and she had organ rejection, and unfortunately she didn't make it.
As for Dirksen-Unruh, she's fundraised to cover her out-of-surgery costs and says whatever money she doesn't need will be donated to another transplant patient. She expects to be back on the organ donation list May 1st. Michelle Bernaro, CTV News.